Kylie talking about her implants. I'm Dr. Vidal. I'm a double board certified plastic surgeon in Miami. Let's discuss it. So first and most importantly, I love the transparency. I love people coming out and saying what they had, why, and giving the public a little bit to compare to. Of course, this is not one size fits all surgery. This has to be tailored to you, but I'll explain a little bit about the things that she mentioned. Number one, the size or volume of the implant, 445 cc's. That it's going to depend a lot between like how much breast tissue you have, the width of your chest, and your goals. So not because you want her look indicates that you need or will have a 445 cc implant, and that's why it's so important, the consultation. The second thing she mentioned is moderate profile. So implants come in different profiles. I have here a moderate and a full profile. These are the two that I most commonly use. A moderate profile is a less projecting, so the distance between the chest and outward, and the width, right? So less projecting, more wide implant. And the full profile is a more projecting, narrower implant. So this is important because a lot of patients think that a full profile is going to give you more volume and it's going to look bigger. Not necessarily. You can go with a more volume implant, moderate, and still have a beautiful volume that she has. So it all depends on your breast tissue, your measurements, and the overall goal. So it depends on how much your chest wall is projecting, how much breast tissue you have. But you can see in her, she's a great example how a moderate profile implant can look full and can have a beautiful cleavage. The other thing that she mentions is half under the muscle. So that what means is it's a dual plane breast augmentation, which means the bottom of the pectoralis major muscle is divided and disinserted. So the implant is covered at the top by the pectoralis muscle and at the bottom by breast tissue. I think it is a great alternative for patients like Kylie that have had kids. It creates a little bit of a lift without the need of a actual breast lift, depending on the ptosis that you have. And also it gives a more natural transition in the chest. I also perform subfascial a lot. Subfascial is a great pocket. It is in between the fascia of the pectoralis muscle and the muscle, and it decreases the risk of animation deformities. Options are there. I think that this is great for patients to get more knowledge and have tools to discuss with your surgeon, but it's not a one size fits all, and the surgeon that you choose is going to explain what plane, what profile, and what volume is best for you and your goals. And the second thing that is super good that she mentioned is the timing of the surgery. She had a breast augmentation, then she had a kid, and it changed. Your breast tissue changes, not only the overall volume droopiness, but also the density. So you may need a revision depending on your goals after having kids, but it's not that you need to wait if you want to go ahead and do a breast augmentation when you're younger. It's just that you understand that this may be a possibility.